Hello, everyone. This is a presentation about clinical documentation. This will be an abbreviated presentation. This is normally a larger 2 hour, about 2 to 3 hour presentation that I give for our students who are in the BWeb program. For the purpose of um, our chapter this week, and our topic, which is recording in social work practice, I'm going to highlight some key things related to clinical documentation. When you think about recording, documenting information, you have to understand the importance of clinical documentation, any documentation, but particular clinically documentation. You also, with this PowerPoint, will learn to identify pertinent content for clinical documentation. Also discuss agency expectation for documentation, identify different structures for documentation, also understand ethical and legal implications of documentation, as well as discuss the best practice and effective strategy for documentation of clinical documentation. Clinical documentation is the creation of a digital or analog record detailing a medical treatment, a medical trial, and/or a clinical test. Clinical documents must be accurate, timely, and reflect specific services provided to a patient. The key areas you want to make sure you cover in clinical documentation is when, where, and whom. Why is documentation important? We use documentation for plenty things. One area is inter-provider communication. And so clinical documentation helps facilitate communication between providers. It also allows evidence-based healthcare system to automate decisions, provide evidence for legal records, and it creates a patient registry function so that public health agencies can manage information and research large patient populations more effectively. Other things that we do with documentation is that we identify billing and coding for staff. And this is important when specific documentation is required when evaluating claims. Healthcare facilities employ clinical document improvement specialists to review each patient's clinical documentation and make certain it is comprehensive with no gaps in services. That's how important clinical documentation is. There are people who are just employed just to look through and make sure clinical documentation meets standards. Documentation is critical for patient and client care. Again, it serves as a legal document to your work. It can be called into court to defend yourself, the agency, and or to help clients out for different situations that they may be going through. It's used for quality insurance purposes, and that is to make sure the highest level of quality is being met in your work with clients. This documents that you followed standards of care, standards of practice, and you're following through with the code of ethics. It validates that patient care was indeed provided. And it also makes sure that you're in compliance with the Center for Medicaid Services or Medicare. It also makes sure it documents and ensures that you're in compliance with the insurance company or other payers and other type of regulatory bodies and or guidelines. It also is important that providers continue to improve their clinical documentation to stay abreast of changes for reimbursement. And so you have to make sure that you are aware of any changes in documentation required to reimbursement. And so it's not just the process of documenting, but making sure that you're documenting properly according to guidelines. The value of documentation. CMS, or the Center for Medicaid and Medicare Services, requires that all medical conditions evaluated and treated, as well as patient's health history, past and present illness, and outcomes are documented in the patient record. So these are just requirements for all medical records, specifically. Conditions, or why is it that you're working with that client, um, and any health history or social history, past or present illness and/or past and/or present issues and problems. Outcomes are to be treatment plans, and ultimately outcomes or evaluation of outcomes need to be listed in your documentation. This is a link where you can learn more about documenting for Medicare, tips for clinical social workers. Please feel free to click on this link, as a hard copy of the PowerPoint will be in your Blackboard folder. And so, value of clinical documentation, right? It has value to the patient, value to the provider, and as well as value to the agency. Some of the values for patient is quality of care. Make sure quality of care was received for a client. It also ensures that continuity of care occurred with a patient as well, or a client. Again, for billing purposes, it's important to make sure that you're billing for eligible conditions and or avoiding ineligible conditions. Provider. Value to the provider is it demonstrates accountability for your work. It's also a performance management tool because your supervisors can review your documentation and see if it's meets regulatory compliance, agency policy, et cetera, et cetera. And also it helps reduce denial of payments, again, as it serves as a accountability for the provider and supervision purposes. So make sure that you're documenting based on high quality standards. Agency, it supports clients in their treatment, and it also makes sure services are indeed rendered. And as I stated before, it has coding, billing, and reimbursement implications, and so it is value to the agency in that way. Again, value of clinical documentation. Most social work agencies will require documentation in the form of an encounter note or a progress note. It also is also useful for audits, regulation and oversight, funding, and retention. Sometimes documentation can show you need more clinical staff to meet the needs of clients, and that can be ascertained. Oftentimes, training also can occur. Sometimes through audits, you'll see that there's more training that needs to be done related to people's documentation. And also, some agencies receive funding through private, public, or government agencies. And making sure documentation, again, is quality. And it's also ensuring that funders who are paying for services to be completed in your agency, it ensures that it's actually being completed. Again, it's a record of services by direct staff, so it serves a staff supervision component. Again, it confirms service delivery. It monitors the interventions that are being done with clients and how they're being done, and the outcomes of them. It mitigates legal risk because it can cover you by notifying what was completed, and making sure that your standard of care was delivered in your practice with clients. And as I stated before, it facilitates communication with providers. Um, Quickly, from an administrative value, again, assessment, it helps managers, directors, and supervisors assess their departments. And this is assessing their staffing needs, and the documentation process itself helps identify areas of improvement, whether it's related to clinical documentation, contacts, frequency of contacts with clients. Maybe it's billing that needs to be areas of improvement, and how billing is conducted. It benchmarks performance. It shows whether a social worker is growing in their in their field, or in their practice, or in an intervention tool, or they're improving in their assessment. And again, a review. It helps administrators review coding and compliance to policies and procedures. And as stated, it helps identify staff training needs. And so this is just a summary of what I talked about here in terms of its use. Again, communication between providers helps evaluate a plan of care, helps with research and documentation, data collection and resource management, utilization review, and quality insurance. What content to use when creating your clinical document? Elements of documentations are important. So you want to make sure that the content, important content, is covered. Okay. So you're looking for the who, what, when, where, and why. You want to refer to agency policies for documentation. So if you're at a particular field agency, you want to make sure that you thoroughly review and understand what the requirements is for documentation. Can be for progress notes, clinical encounters. Most likely your documentation has to be signed off by a supervisor, but this is also for process recordings too. or reports that you may be filing with your agency. Make sure that you're following the guidelines strictly for documentation. Templates are helpful when you're working in social service agencies, but templates are only a guide and do not replace clinical judgment. So they're supposed to guide your thinking about content, and let you know what should be in the content. But clinical judgment and proficiency and skill cannot be ascertained from the template itself. Elements of documentation. Documentation needs to be clearly written and organized, free from grammatical errors and spelling errors. Notes must avoid acronyms. All notes need to be dated and authenticated by the provider. Each patient encounter and key players need to be documented, and service codes need to reflect the documentation as well. Again, some of the summary of the key elements is complete, legible, timely, patient-centered in your language and use of language, respectful, appropriate, accurate, and clear and concise. What should you include in a clinical note? This is a link. Please take the time to click on it. Again, as the hard copy of this presentation will be on Blackboard. But this talks about examples of psychotherapy, progress notes, and other structured formats. Something to think about use in areas that you cover with your contacts with clients. Structure for documentation. Here are different models, and this one here is important. It's called the SERP model. And the SERP model covers situation, problem, or barrier identified, intervention, detailed description of services, response, client response to proposed intervention, and plan of action for intervention. This is one method used, okay? One method used for documentation. There are many. Key content areas, progress encounter notes. You want to make sure that you cover any change in progress, responses to treatment, changes in treatment, and or patient non-compliance notes. When you're thinking about plan of care, discharge or termination note, treatments are important, medication and dosing are important, referrals or care transfer are important to document, and discharge instruction and or ongoing plan. Again, key content areas, past and present problems and or diagnosis, reason for assessments, tests or screens, relevant risk factors important to cover, support, diagnosis, problem, and treatment intervention. So any documentation that supports the diagnosis or supports the problem, and or any documentation you can include that supports the treatment and intervention plan. Key content areas, again, referral and resources, forms, screens, and assessment tools, correspondences between providers, patients, or other entities, key documents such as discharge summary, transfer notes, and or screens, and engagement level of clients. So you want to make sure you're recording their participation, any feedback provided, any barriers to care or barriers to working with the client, and any summary of progress. Steps in documentation. Step 1, engage and assess. So you're engaging and assessing strengths, accomplishments, and resources. And again, this is with client or client systems. Treatment plan, regulatory requirement, roadmap to progress. Step 3, delivery of services. And step 4, documentation of services. We do have an official guide here at Howard University, and it's called the Howard University Guide for Case Management. Most students should have this or have been provided this as part of your introduction to Howard University. It is very comprehensive guide that we use to help guide students with case assessment. It is entirely too large to include here, but I did identify the key areas that is in this guide, and it can help you think about clinical documentation. It has areas where you can identify, it's a template, but it helps you identify identifying information for the client, presenting problem of the client, referral sources and process, what is the living situation of the client, relevant history, relevant medical, psychiatric, education, and social service history, assessment of client personality, or assessment of client development or social roles and or ecological systems, intervention planning, termination and follow-up, and evaluation. These are the key areas in the Howard University Guide for Assessment. And there are also subcategories under these major headings in the guide. HU guide for case assessment. Um, when you're doing these, again, any type of template, even the HU guide for case assessment, it does not replace clinical judgment and clinical expertise. So you want to be aware of major challenges or conceptual elements that are important when you're um, developing your case notes or progress notes. One are ethical standards and ethical dilemmas. So you need to be self-aware when you're documenting, aware of your services, your competencies, your strengths, your limitations. You want to make sure that the professional use of self is demonstrated in your note. Social work values and ethics, you want to make sure that is conveyed in your note-taking process and your engagement with clients and how you engage with clients. And you want to make sure that you note and document any identification and or resolution of ethical dilemmas. Also, you want to be aware of leadership and provision of leadership in your agency and in the profession and your interdisciplinary team or stakeholders. So again, you want to make sure that you're following agency standards, professional standards, and being mindful of your team members and stakeholders in the documentation process. And all these values, these concepts, these ideas need to be considered when documenting. So it's not just documenting, but it's also the higher levels of quality in your documentation as well. Other things to think about when you are documenting, and what we encourage students to do when using the Howard University Guide for Case Assessment is making sure that when you're documenting that your advocacy skills and value and standards related to advocacy shows in your documentation, as well as your promotion of social justice. And this includes making sure availability of resources for social and economic justice are listed in your documentation, making sure that you list appropriate channels for action, policy implications, and implications for social change. And also consider the Black perspective, the Howard University's Black perspective, social justice. Is that conveyed in your note? How about importance and respect of diversity, internationalization, vivification, affirmation, and strengths? Are these guiding philosophies clear and demonstrated in your note? The HU Guide for Assessment also has a mental status exam. All your agencies may not require a mental health status exam. However, these are things to think about when documenting. How did the client appear? How did they behave? Was there any peculiar observations related to psychomotor activity? What was the client's attitude towards social worker and interview? Affect and mood. Is there anything relevant and significant to document there? Speech and thought. Perceptual disturbances, orientation and consciousness, memory and intelligence, reliability, judgment, and or insight. Again, mental status exams may not be necessary in all your placements, but if you notice any disturbance, whether it's in mental status, whether it's required or not, it may need to be documented in your clinical note for your agency. And again, another key area is ethical documentation and some of the best practices in documentation. You want to make sure that you're using person-centered language, strengths-based language, avoid judgmental language, and particularly when you're writing case notes and process recordings. Identify key aspect of a person's identity. And again, your language is reflective of the type of service you provide. So make sure that your language in your note is both hopeful, respectful, strength-based, non-judgmental, and assumption-free. Other things to consider in terms of best practices and documentation is how long should you take to document a note. Um, Regardless of how long it takes you to write, you have to be mindful that you have to be efficient and you have to turn that note around in a timely way so that your treatment team or your case management team that you're working on is able to see what's going on and can bill properly, um, continuity of care, pick up, cover you if you're out on vacation or something. But you need to make sure that it is timely. And it's hard to be timely and accurate, but that speaks to quality and high quality standards. And so be mindful that your time is billable. So taking too long is a problem. Encounters need to be reflected, and there may be specific policies in your agency on how quick a note needs to be entered um, um, after the contact is made. And for referral purposes, it's important to get your note in timely because a referral may be needed, and sometimes it takes additional time for clients to receive services once a referral is made. Did I write too much? Ask yourself need to know. Only thing that should find its way in your note is need to know information. Clinically relevant, encounter relevant information. Do I need to write more? If it's not documented, didn't happen. So one thing to think about is, did you cover the key things that you need to make sure that is documented so that you can ensure that these activities, this contact indeed happened? Again, rule of thumb, if you don't document it and you can't prove it with documentation, it didn't happen. Do I have enough details? Avoid too vague of statements so that people don't know what it is you did and what intervention you provide. You don't want to be so vague that people can't understand what the outcome of your assessment was. Consider note review with supervisor or colleagues. Have someone else have a second set of eyes on your notes as well. This is a link for standards for clinical documentation. Please click on that to get more information. Ethical standards and social work documentation is also listed here. And so now we're going to talk a little bit about myths about documentation. Vague statements are ideal. No, if it's too vague, people do not know what you did. People cannot work with you or work alongside you if they don't know what services you provided to clients and they don't know how to pick up after you either. This doesn't cover your work. This doesn't show that you're competent. So make sure that your statements are not too vague. Fear of details for court. That's a myth. Sometimes key details are important for court. Just document, no alignment, connection, and synthesis is needed. No, it's not just about just putting context there. You have to align. It has to have a progression. It has to make sense. It has to build off of what was written before or close out. So understand it's a narrative. It's a story. And so it must be concise, it must have alignment, and ideas, concepts, and progress must be connected. Clients should not see notes as they won't understand them. No collaborative documentation with clients. That's a myth. Be mindful. Do not you write your notes in a way that your clients will be able to look at them right after you write them. If there's something that makes you uncomfortable with a client, if you're writing your notes, then maybe there's something wrong specifically with your note. Oftentimes, clients have the right to see their notes, and oftentimes providers will share their notes with clients so that they can explain to them any clinical terms that may be vague or unclear. This is just a quick review of clinical documentation. Please take your time to read the chapter in detail that covers clinical documentation. And also, I strongly urge you to think about clicking on those links because there's a lot of resources in this PowerPoint to help you with your documentation. Thank you.